My name is Anna Roth-Trowbridge, and I work as an emergency nurse at one of Vancouver's busiest hospitals. I doodle on the side. COVID-19 has changed how healthcare workers think about our roles and our workplaces. It is a strange thing to be praised for bravery while stewing in fear. The first time I heard the sounds of the applause and the cacophony of pots and pans rippling across False Creek, I sat down in the grass and cried. My coworkers and I flocked to the sidewalk in front of Vancouver General Hospital at 7 p.m. to reciprocate the cheer, many of us fogging up our goggles. The acknowledgement of our collective stress and efforts was a wave of validation that fully strengthened our resolve. Hospitals have always felt like home to me. My parents both worked as caseworkers in child psychiatry at the Jewish General Hospital in Montreal. On days off from school, I enjoyed participating in art therapy groups led by my father. And later, my family and I were constant visitors when my dad became a cancer patient. I've come to understand that healthcare does not serve the population equally, that many people do not receive the care they need, and that it's because of my privilege and my family's story that the frequent alarms and the familiar palette of the hospital are actually symbols of safety to me. As an ER nurse, I try to bring my own sense of safety to my interactions with patients and families in crisis. Those of us who work in the emergency room stay calm through the act of providing care. We start IVs, cut off clothes, make eye contact, provide reassurance. Up until the pandemic, I didn't fully understand how much comfort and stability I derived from caring for others. Then the first wave of COVID-19 arrived in Vancouver. It undermined the safety of our healthcare system and the hospital. We started wearing personal protective equipment during all patient contact. It's very challenging to communicate safety through a mask and goggles without family members present, with so much emphasis on infection control. We retrained our brains to prioritize personal protection before jumping in to attend to the emergent needs of our patients. And suddenly, the hospital did not feel so safe. I was consumed by fear of transmitting the virus from patients to loved ones and vice versa. It's really hard for me to imagine doing what nurses around the world have been doing for months now. And that is providing care without proper PPE, knowing that your vulnerability to the virus will put others in danger. Watching people dying in horrifying numbers, watching coworkers die from COVID-19. These so-called frontliners are assuming risks well beyond what they initially signed up for, well beyond what they are compensated for. I am scared of calling people heroes with the assumption that they will bravely accept the risk now associated with their jobs. I'm scared of the pressure that we are putting on essential workers to overcome their fears through our choice of language and the stories we are telling. Here in Vancouver, those of us working in high-risk areas have experienced measured relief as we watch the numbers drop, as new protocols seem to effectively control transmission within the hospitals. We have the capacity to make light of the fashion opportunities born out of the pandemic and to enjoy solidarity and pizza among the staff. Our team has been strengthened by our collective resolve to protect one another and our patients. And we have learned to work together in new and exciting ways. COVID-19 has highlighted a lot of the holes and inequities in our system. It has also taught a lot of us on the front line about the impact a threat to personal safety has on one's ability to function. Feeling like I am cared for by my team, by the public, and by my community made me want to care for others more than ever before. Thank you, everyone out there, for your tremendous show of support. Keep talking to your loved ones about their wishes and what they need to feel safe, and let's keep taking care.